Why, hello there. I didn't see you there. I'm Ron Burgundy with Action News 6, here to talk to you about cycles therapy and why you should be doing it for your kid. A perfect kid for this therapy are children who are highly unintelligible. This therapy was not designed for children with mild speech disorders, as it focuses on emergence of a specific sound or pattern, rather than the mastery of it. Children tend to also score in the profound to severe range in the Hodson assessment of phonological processes, a very well-known processes exam. Common utterances for potential candidates include extensive omissions, phoneme substitutions, and a very restricted set of consonants. An assessment analysis shows 7 underlying approaches that are beneficial for the proposed client. These approaches are: phonological acquisition is a gradual process. You see, children typically do not learn each sound to a 90% criterion and then learn the next sound to a criterion. The principle is the major reason for the cycles approach, which enhances phonological patterns in a sequential manner, and then recycles patterns as needed until the patterns begin carrying over into conversation. Number 2, children with normal hearing typically acquire the adult sound system primarily by listening. Children need optimal hearing and adequate perceptual skills during their early speech learning years. Number 3, children associate kinesthetic and auditory sensations as they acquire new phonological patterns, enabling later self-monitoring. Number 4, phonetic environment can facilitate or inhibit correct sound productions. Production practice words must be chosen with extreme care during beginning cycles. Words with phonemes at the same place of articulation as the error should be avoided until later cycles. Number 5, children tend to generalize new speech production skills to other targets. We know that children generalize, and sometimes overgeneralize. Words with phonemes at the same place of articulation as the error should be avoided. Yes, that is correct. Number 6, an optimal match facilitates a child's learning. Phonological analysis determines the child's match, so that treatment can begin one step above the child's current functioning level, resulting in the child being ultimately challenged but also successful from the beginning of the treatment until the end. Children are actively involved in their phonological acquisition. Number 7, this principle is important for children with speech-bound disorders as well as for typically developing children. Young children need to be actively engaged participants rather than passive imitators. Our next section is selection of target sounds, which may sound like it would be complex and hard to do, but it's not. Target sounds should depend on the client's stimulability. Targets are consistent phonological deviations or patterns occurring 40% or greater in the child's speech repertoire. Primary patterns are targeted first. Da, early syllable structure pattern, anterior-posterior contrast, S clusters, and liquids. Then, secondary patterns are targeted, such as palatals, other consonant sequences, stridents, prevocalic voicing contrast, vowel contrast, assimilation, and other remaining idiosyncratic deviations. For example, if a client has a high frequency of the common process final consonant deletion, then CVC word structure will be targeted for the therapy sessions. So after all this information, you probably want to know how we obtain baseline data. Baseline data is obtained after the first therapy session and is then used to compare and contrast results and progress throughout the therapy time frame. Description of the treatment. Cycles training divides phonological patterns and targets them during specific time periods known as cycles. Cycles follows a consecutive order. Each phoneme within a pattern should be targeted for 60 minutes per cycle. If the therapy is only held 30 minutes per session, twice a week, then the first phoneme would be targeted for 1 week of therapy. Each remaining phoneme is presented consecutively for 60 minutes each. At least 2 examples of the pattern should be presented in 2 consecutive 60-minute time intervals before moving on to the next phoneme, or cycle. So assuming cycles therapy has already begun, here is a sequence of a typical cycles therapy session. Number 1, treatment would begin with a review of the previous session's word cards. Number 2, this would be followed by auditory bombardment or amplified auditory stimulation for 1 to 2 minutes while the clinician reads for approximately 12-word picture cards. Number 3, the client then draws, colors, or pastes pictures of 3 to 5 target words on large index cards in which the child repeats the word modeled by the clinician. Number 4, during experimental play, the clinician models or uses tactile cues, such as touching the child's throat, to indicate a velar production, while client and clinician take turns naming pictures. Number 5, the child's stimulability is assessed for potential targets for the next cycle by asking the child to model several words that contain the potential targeted phoneme. Number 6, auditory bombardment is repeated. Number 7, a home program is set up with the client and caregiver for 2 minutes a day. The client and caregiver read the words for the week during auditory bombardment, and the child names and practices picture word cards at home. Now that we've described the cycles therapy and the sequencing, I bet you're wondering how and when we collect that sweet, sweet data. Well, data is collected after the auditory bombardment and cycles treatment by assessing the stimulability of the child's next potential target phonemes. Since emergence, not mastery, is targeted during cycles therapy, the clinician will take notes of production, but tracking all responses is unnecessary. Reinforcement strategies are very important and include modeling and using tactile clues during experimental play. Tactile clues includes touching the child's throat to indicate a velar production, or touching the upper lip to indicate an alveolar production, so that the child receives 100% success on target patterns. Also, as a little extra, giving the child a high five or a big thumbs up is always welcome as well. Advantages and disadvantages of this. The targeted patterns within the cycle are used to stimulate emergence of a specific sound, not mastery of it. Therefore, cycles therapy provides the opportunity for children to increase intelligibility within a short period of time, while providing increased opportunities for acquisition of certain sounds and patterns. This therapy attempts to follow the natural, gradual process of phonological acquisition. Several sounds can be targeted within one cycle, which is awesome. Some disadvantages. What's not to like? Sure, there hasn't been a lot of research done, but who needs research? This is, after all, cycles therapy, the best therapy you can do for your kids.
Hi, this is Kendall Kalish with Action 6 News, here today to demonstrate cycles training with our client, Susie. Hi, Susie.
Hello.
First, we're going to review last week's word cards.
Wham!
Good job.
Wham!
Good job. Then we're going to engage in auditory bombardment for 1 to 2 minutes. All done.
Yay!
Susie, I want you to say these words after me, and then we're going to glue them onto index cards. Mom.
Mom.
Go ahead and glue this picture onto an index card. Don't eat it. Good job. Man.
Man.
Leg. Next, we're going to engage in play. Susie, when I roll this to you, you say the word, and when you roll it to me, I say the word.
Man.
Now you can roll to me.
Word.
Good job.
Wag.
Mom. Then we're going to assess stimulability for next session by presenting more word cards. Cat.
Dog.
Kite.
Kite.
Good job. We're going to engage in auditory bombardment again for 1 to 2 minutes. All done.
Yay.
Finally, we set up a home program. Hi, Mrs. Douglas. Susie did really great in therapy today. Here's a list of words to work on at home for 2 minutes per day. This is Kendall Kalish signing off with Action 6 News.
Oh, hello there. This is Ron Burgundy back again, this time in Street Clothes, to sign off. But before we do, we have a very special production for you guys. The credits!